Hello, Ultimate Caregiver. Today I would like to discuss the 9 always of a caregiver. 9 things that you should always do when caring for your patient. So let's start. Number 1, always arrive on time. Arriving to your patient on time reassures your patient that they are in good hands. When you arrive late, you provide a sense of insecurity. Our patients feel anxious, they feel worried, they feel that they cannot depend on you and on us as an agency. So please make it a priority to arrive to your patient on time. Another reason you should always arrive to your patient on time is that because, believe it or not, we as a team, all of us, you included, we are all being graded for punctuality. Punctuality is actually one of the factors that is used to determine the level of quality that an agency provides. So when you get to your case late, you're actually not only affecting your patient and the way the patient sees you and the agency, but you're actually affecting our grades as a home care provider. So first and foremost, the first reason you should arrive early is because you want to make that impression the best impression possible. You want to build a relationship of trust in your patient, between your patient and you, so that you can have a positive influence in the healthcare decisions of that patient. Number 2, the next very important thing that you should always do is keep your life and personal issues private. You do not want to share with your patient any personal information, especially the negative things that might cause an additional burden and strain on a patient that is already vulnerable, that is already sick, and that may already be experiencing challenges because of their health, because whether it's in an emotional level or on a physical level, our patients already have concerns that they have to deal with on a daily basis. So the least thing that you would want to do is share that personal negative information. So always keep your personal information to yourself. Number 3, always communicate. Extremely important for us to communicate. You must be communicating with the nurse, with the placement coordinator, with the agency to make sure that that patient is not affected by any lack of communication. So whether you need to communicate a change in your patient's health status, that could be the difference between that patient being hospitalized or not. That could be the difference between that patient's life being saved or not. So really important for you to communicate. And if you're ever doubting whether you should communicate something, please err on the cautious side by communicating it anyway. So always communicate. Number 4, always give enough notice when you are wanting to use your PTO, your vacation time. We want to ensure continuity of care in our patients. So that means, emergencies happen to everyone, but as much as it is possible within your hands to give notice, please give as much notice as possible so that your patient is not left without service. Okay, that's the least thing that we want. We don't want our patients without service because of a lack of communication or because you did not give enough notice, giving your coordinator enough time to find a replacement for that very special patient. Number 5, always avoid using your phone for personal reasons while you are with your patient. Think about the message that you're giving your patient if you're on your phone for long periods of time or for personal usage. You're telling your patient that your patient is not very important, that your attention is for your phone, when in reality your attention should be completely undivided towards that patient. You're not only increasing security and trust levels in your patient, but you are also avoiding any distractions that may inhibit you or not allow you to notice things that are important for your patient. So following that plan of care, preventing falls, reporting abnormalities. When you're on your phones, you can't do that. So always avoid. So the message that you want to give your patient is that they have your undivided attention, that they are special, that they are important to you and to ultimate care. That is the message you want to bring out, because ultimately, if your patient does not feel that you care about them, you will not have influence over the decisions that they make. And you want to have influence over the decisions, especially healthcare decisions that your patients make. That is the way that you are intentionally going to be reducing hospitalization and unnecessary visits to the emergency room. Number 6. Always provide the very best care to your replacement case. So you might not be the permanent aid for this patient. It does not give you a free pass to say, I'm not going to follow the plan of care. This is not really my case. I think that should be an opportunity for you to show that no matter who your patient has, they will receive the best care at Ultimate Care. It also gives you the opportunity to show off how good of a caregiver you are. You're letting your patient know, hey, your regular aide is not here and you might be a little anxious about it, but you are in good hands. So reassuring your patient by giving them the best care, even when they're not your permanent case, goes a very long way. It ensures consistency and continuity. Think about it. If your patient has a bad experience with you as a replacement, chances are that the next time their home health aide has to take a day off, guess what the patient will do? They will refuse a replacement. They won't want assistance. That puts the patient again at risk for getting back into the hospital or to the emergency room. In order to provide continuity of care, please make sure you're providing the best care even when your patient is a replacement and is not your permanent case. Number 7, always provide proper case acceptance or denial. So if you're accepting a case, make sure you follow up in writing about it. You want to make sure that you don't give a mixed message, I'm accepting the case and oh no, I realize that it's too far away from me and that I'm not going to be able to make it. Please make sure you put that in writing. There's the HHA at Ultimate Care NY email that you can feel free to write at us at any time. Obviously, you want to give enough notice, but being able to communicate effectively and in writing goes a long way. And ultimately, your patient benefits from it, you benefit from it, and we as a team benefit from proper communication, especially if it's in writing. Better. And finally, number 8, please make sure that you always reach out to our on-call number. Our on-call number is our regular number. It's actually the 718-257-0702, and there is always somebody on call that is ready and available to service our patient or to assist you with any concern or any question. Don't forget to use our email, hha@ultimatecareny.com. As a bonus that I want to throw in, something that you should always do is always continue to educate yourself, always continue to grow. We can only give as much as we have. So the minute we stop educating ourselves, the minute that we stop giving our best to our own selves, is the minute that we stop being able to give further to our patients and to the people who rely on us. So, Ultimate Caregiver, thank you so much for providing the best care in New York City. Have a great day. Again, this is Nairobi providing clinical motivation here at Ultimate Care. Thank you.